virus.
Right.
And, you know, Bark has asserted that quarantining the public will prevent herd immunity. What do you think about that?
Well, there's some logic to that line of thinking. Diseases spread by direct contact, and this one is no different. And as a larger percentage of the population becomes immune to the disease because they've had it already, then the less likely it's going to spread. Now, obviously, more people need to be introduced to the disease before that starts taking effect. That's kind of the herd immunity mentality, anyway. There are people that insist this is going to be like the flu. It is a viral infection, and it's going to spread throughout the population slowly or quickly or whatever. But it's going to be in the future probably, and quite probably going to be like, you know, I got the flu, oh, I got corona, you know, that kind of a thing. But the more people who've had it, then the less likely it is to spread through the population, I guess, is his argument and logic there, which does make sense to a certain degree. Go ahead.
Sorry, go ahead.
Yeah, quarantining healthy people has never been done before that I know of. You quarantine the sick, and preventing people from going about their daily lives because they might get a disease which they're probably eventually going to be exposed to somewhere along the way anyway. I don't know if that's a really logical path to follow. Now, I understand the concerns. They don't want to overwhelm the healthcare system and so forth. And
Sure.
there's maybe some logic to that. But as far as individuals getting it, there's going to become a time in the future, whenever that is. We don't know. Obviously, we're still flying blind in many ways on data here, which we'll talk about a little bit later, I suspect. But there's something to be said about that. Yeah, go ahead.
There are those who say this whole thing is a sham, and it's really no more dangerous than a bad case of the flu. There are some that say the mortality rate is as high as 6%, and there are others that are saying no, it's only about 0.5%. Is it just the flu? I mean, is it like the flu, or what do you think?
Well, it is a viral infection. That's not in question by anybody, I don't think. So in that way, it's a virus, and the flu is a virus. So there's some definite transmission similarities and things like that. As far as the projections they were making early on, they were just dire pandemic, hundreds of thousands of people dead, you know, and dying and overloading the medical system and yada, yada, yada. That did never pan out. And I think on some level that there was some pre-planning here of how we're going to deal with a pandemic of this nature, whether it's the COVID or whatever. You know, what are we going to do if? And they put some things into place that I believe have been in planned, like what do we do if, for a long time. And the media hyped it up, and there was a lot of hysteria, and people are doing some things that they normally wouldn't do as a result of panic. Oh, we're all going to die, and that sort of mentality. But most of the numbers I've seen, at least early on, were incredibly inflated estimates because they didn't really have any data to go on. And the current numbers are, Governor Stitt was just mentioning, I believe it was last week, that, you know, it's less than 1/100% here in Oklahoma. So there's definitely not a pandemic danger here. That's based on data, not based on hype, not based on panic, not based on anything but, okay, what are our numbers? And also something interesting in Oklahoma, it's very localized in 2 or 3 counties. The majority of the state of Oklahoma, they don't have maybe 1 or 2 cases of corona in the whole county. So it's very localized is what I'm seeing, and localized around the metropolitan areas, it seems anyway. Go ahead.
Yeah, that's a good point, and I wanted to ask you about that because there are some people who are saying that the reason why you see so many cases in urban areas is people in the rural areas bring their patients to Oklahoma City because the hospitals are better, and so that's where people are being treated and dying.
Well, I think there may be, I think there may be some oversimplification there.
Could be.
Obviously, people do, if they've got something that's life-threatening, they're going to go to the biggest, most modern hospital that they can. And obviously, the rural mom and pop towns don't have a big, huge medical center here. Where in Oklahoma City, we've got half a dozen large medical centers that are state of the art. So there's some logic to that, but that population is going to be pretty much limited to being in the hospital. And unless you go in the hospital, you're not going to take that out with you. I think more likely it's because the big cities have a lot more transient influx and outflow of people, and they're just exposed to a lot more individuals per capita. If you've got a town with 3,500 people in it, and you see them, on a regular basis, and nobody leaves or comes into the town, you've got an isolated population. There's no disease there. Whereas people are coming into and out of the Oklahoma City metro area and the Tulsa metro area and the bigger places like that, and you're just percentage chance more likely to be exposed. I think is more likely the cause, just on the face of it anyway. It seems more reasonable to me.
Let me ask you personally, what are you doing for your family? Are you wearing masks? Are you staying 6 feet away from people outside of your family? How are you handling this?
Well, the Bible instructs us to be loving toward other people.
Sure.
And so that's where we go with that, I guess. No, when this first all started, well, my family, we already had masks at home for painting and mowing the lawn and just stuff like that. We did grab a few extra at the first of it because it was a big question mark. It was an unknown. We've never worn them. Grandma sent masks for all the kids, and they wore them around the house playing pretend, but they didn't actually wear them in public. Actually, if you're trying to prevent yourself from getting COVID, it makes a lot more sense to me to go around wearing safety glasses to protect the soft tissue around the eyes and so forth. There's a lot more likely chance you're going to get it transmitted by rubbing your eye than there is, touching your face and that sort of thing, just statistically. So all these people wearing these, I saw somebody with literally a hazmat type full face respirator with the cartridges and stuff, and the eyes are totally unprotected. And I just thought, that's you're missing part of the picture here. The soft tissue in the eyes is a whole lot. I mean, it can go directly into your bloodstream there. So if we're serious about this, and the powers that be know this, you need to get people wearing safety glasses more than wearing masks. Would make a whole lot more sense to me. And a lot of people obviously have prescription eyeglasses already, and they're a lot more protected than those who aren't. But I don't hear anybody going, we've all got to wear safety glasses. And so
what about social distancing? Do you stay, when you go to the store, do you try to stay 6 feet away from other people, or?
I'm conscious of that, not for disease transmission, for just respect and to love my neighbor. I don't want to cause them to be uncomfortable. I'm not concerned about, I'm not going to stand, 6 inches away when I talk. I'm going to maintain give everybody their personal space. But I was that way before this all started. That wasn't new because, COVID. During flu season, it's just common practice, at least at our household, wash your hands regularly, don't drink out of the public water fountains, things like that. So there wasn't any big radical change for the Grant household. It was just pretty much business as usual, and bummer, we can't go to wherever because it's closed. So we have some things on the shelf that we keep around all the time. We take our vitamins to keep our immune system built up. We have colloidal silver that we keep bottles of in stock, and colloidal silver kills the COVID virus. So that's something we already had. We didn't go out and buy some because of that. It was just already on our shelf because that's what we do for colds and flu and things like that and so forth. We have a Spectre bright light therapy machine, which also kills as my understanding, the ultraviolet attachments kill the COVID virus as well. So,
Darren, let me also ask you about these children who seem to have some type of version of COVID-19 in New York City, and it's horrible. I don't recall exactly the disease I think it's Kawasaki disease or something like that. what should we be concerned about our kids and our grandkids?
Well, we're always concerned about our kids and our grandkids getting sick, whether it's this or something else.
Sure.
That's just parents and grandparents. That's just the way we are. But you know, we can't live our life in a plastic bubble, and we can't live our life in fear. The Bible says over 300 times, "Fear not." So we're not supposed to walk around in fear. We're supposed to fear God. But I don't think we should be fearing COVID or the bubonic plague, or as far as any information or numbers coming out of California, I take with a huge grain of salt, and sometimes
This
I
is
have to
New
even
York.
interpret it. Yeah, specifically New York, because their data is consistently one thing: wrong. All the data I see coming out of New York is either hyperinflated or it's been filtered through an agenda and comes out, and I'm not sure what their point is, but their numbers that they report versus what's actually the case. Um, I was watching a news program, and they had a guy coming in he had a car accident, you know, and he died of the trauma from the car accident, but they tested him for COVID when he came in, just to make, to quarantine him or whatever, and he showed up positive for COVID, and he's got, COVID was the cause of death on the death certificate when the guy clearly died from a car wreck. I mean, and that's not an isolated incident. They were going over this laundry list of all these different people who have a comorbidity, and they are testing positive for COVID, but they didn't die of COVID, but they're being reported that they died of COVID to inflate these numbers. And that bothers me. When you can't trust the data being put out, you can't make rational, informed decisions.
Sure.
And as a scientist, that bothers me, because I look at the data. I don't look at the hype. I don't look at the glitz. I look at the numbers if I can, but I can't get good numbers. I have a guy I work with as a volunteer at a Christian camp on a pretty regular basis, and he's a medical doctor. He has access to all the CDC bulletins and things like that. And we were talking about this maybe the first week this COVID stuff came out. And since he's a medical doctor, and I respect his opinion, I asked him, well, what do you think of this? He goes, you know what? This thing's really weird. Because when we get a health bulletin, they're full of pertinent information. What's the most likely people group to transmit in? What age range is it affecting? What are the high risk groups we need to be aware of? Things like that. He goes, these are painfully lacking in any of that information. So it's like they were cluing in the doctors, okay, this is out there, but they weren't giving them any information to do anything about it, to deal with it, to take precautions. He said, I've never seen this before. This was unique. This was different. And later on, they started getting some information, but he noted the very conspicuous absence of any information, as to him kind of set off a red flag. It's like, what's going on here? This is not normal CDC bulletin information. They're giving us nothing. So that kind of got my radar up a little bit, going, well, what's going on here? That's weird.
Also, there have been several allegations that and I think you've alluded to that already, that there have been many cases that people dying supposedly of COVID-19, and that hospitals and health facilities get more money through government programs if they designate cause of death as COVID-19.
That's one of the things that was, back to New York again. That's why this seems to be happening there, or maybe it just seems to be reported more there. I don't know. But yeah, the cause of death is linked to COVID. They get several $1,000s for each COVID patient, and the government is incentivizing treating COVID patients because they passed a law, the Congress did, saying you get 20% more if you treat COVID patients. And just stuff like that is really skewing the numbers, because what you subsidize, you generally get more of. And, basic laws of consumer behavior. If you subsidize something, you're going to get more of it. And if you put them on a respirator, you're going to get almost 3 times as much.